Hello my friends, my name is Dr. Sayed Kazmi. Welcome to my YouTube channel, and in today's video I'm going to talk about abdominal masses in children. So before I get started on today's topic, for those of you who are watching my channel for the first time, a subscribe would be fantastic, and if you like my videos, please do share it with your friends, press the like button, and don't forget to press the bell notification icon so whenever I upload a new video, you're always on board with me. So without further ado, let's start our today's topic and get started right away. So the topic for today, as I told you earlier, is abdominal masses in children. So what is an abdominal mass? When you are examining a child for any reasons and you are palpating his abdomen, if you find sort of a solid structure within the abdomen which you can feel with your hands, that is an abdominal mass. And usually when you feel an abdominal mass, it means a pathological condition, because the normal organs which are there in the abdominal cavity, you should not be able to feel them with your hands unless and until the child is very much skinny. Now keep it in mind that abdominal masses in children can be classified into acute abdominal masses and chronic abdominal masses. If the history of that abdominal mass is for less than 2 weeks duration, we call it as acute abdominal mass. But if the history is for more than 2 weeks, which could be like 2 months, even more than that, that is chronic abdominal mass. Now, let's talk about acute abdominal mass. An acute abdominal mass is, as I told you, where the history is less than 2 weeks. Usually there are only a few conditions that would lead to an acute abdominal mass, because it comes to the attention of a doctor because of the associated features, which is mostly abdominal pain. So one of the most common causes of acute abdominal pain in children is constipation. Most of these children already have got a history of constipation, or they may not have a history of constipation. But what happens is that they usually present abdominal pain, and when you are palpating their abdomen, you will feel the hard masses, which are basically fecal masses, and most of the time you will palpate these masses and you will feel them in the left side of the abdomen, because it's mostly the descending colon and the rectosigmoid area which is full or loaded with feces, which you can feel with your hand, and that is also causing abdominal pain. So one of the most common causes of acute abdominal masses is constipation, which is very, very common. Another one thing we should never miss when we talk about acute abdominal mass is intussusception. Now, intussusception is a condition in which one part of the intestine telescopes into the another part, and it can occur in any part of the intestine, but most commonly it's either in the distal iliac region, or it can be any part of the large intestines. Now these kids are usually aged between 3 months to 6 years. Most of the time they would be between 3 months and 3 years, though it's a bit rare after that. But anyhow, we have seen cases where intussusception has been reported even in kids up to 5-6 years of age. So usually these kids, they have got a history of screaming off and on. So uncontrollable crying. In between they might be absolutely fine, and there might be a history of slight abdominal distension as well. There might be a history of vomiting, and in the later stages of the disease they might be having bloody diarrhea, or what we call as red currant jelly stools. But if you examine them, you might be able to feel a sort of a mass, vague mass on the right side of the abdomen. Again, ultrasound is the best diagnostic modality for this condition, and air contrast enema can not only be diagnostic, it can also be therapeutic in these conditions. So intussusception is one thing which you should never miss in a child who presents with abdominal pain and acute abdominal mass. The third condition which can cause an acute abdominal mass is a distended urinary bladder, because there is usually some degree of obstruction distal to the bladder. So it might be posterior urethral walls, it might be any structural abnormality which is affecting the urinary tract distal to the bladder. So the child would come in acute discomfort with a history that he has not been able to pass urine or has been dribbling, And if you palpate his abdomen, you will be able to find an abdominal mass in the lower abdomen, mostly in the hypogastrium. So these are the three important differentials in acute abdominal masses. Now coming to the chronic abdominal masses. The chronic abdominal masses can literally arise out of any structure which is there in the abdomen. So liver, spleen, kidneys, adrenal glands, intestines, the musculature of the posterior abdominal wall. Anything can give rise to an acute abdominal mass. But most of the times, the causes of chronic abdominal masses are usually enlargement of the liver or the spleen. And the liver and spleen can get enlarged in many conditions. It could be chronic hemolytic anemias, it could be other hemopoietic disorders like myelofibrosis, it could be infiltrative conditions, or it could be cancerous conditions like leukemias and lymphomas. So usually these masses, the liver is usually palpated in the right upper quadrant, spleen is palpated in the left upper quadrant, and obviously you can feel for the splenic notch and you can feel for the liver border, and usually these masses are a bit comparatively easier to diagnose because of their peculiar anatomy. Two other things which can cause vague abdominal masses where the borders of these masses are not very clear are usually masses arising out of the kidney or from the adrenal gland. Now the mass that usually arises from the kidney is Wilms tumor or nephroplastoma. It's usually a mass which is either in the left upper quadrant or the right upper quadrant, but it does not cross the midline. The child is usually around 4 or 5 years of age. If you do a urine dip, you might find hematuria, you might find proteinuria, and if you do the blood pressure of that child, it might be elevated. In contrast to Wilms tumor, the tumors arising from the adrenal glands, which can be either pheochromocytoma or neuroblastoma, they are usually, again, they are vague just like Wilms tumor, but they usually cross the midline to the other side. So they might be in the left or the right upper quadrant, but they are usually crossing the midline, and you can feel the borders on the other side of the abdomen. And associated with that, you might find that the blood pressure episodically rise. There might be a history of episodic flushing, episodic tachycardia, and chest pains. And the best screening test in such a condition is urinary VMA, which is positive, actually points towards diagnosis of pheochromocytoma or neuroblastoma. Some of the other tumors arising from the posterior abdominal wall, like rhabdomyosarcoma, can also give rise to abdominal mass. These are usually very vague and it's not easy to palpate these masses. Nevertheless, as I told you, there would be other associated features of rhabdomyosarcoma like fever, weight loss, so on and so forth. So whenever you feel for an abdominal mass, see whether it's an acute one or the chronic one. Associated features can guide you towards a likely reason for the abdominal mass. Like if there is a history of constipation, obviously you can think that it might be fecal masses. If there is a history of poor stream or a child not passing urine, then you can think of a distended bladder. If there is a history of a weight loss, history of low-grade fever, the child has got bruising and things like that, easy fatigability and repeated infections, you might be thinking of leukemias, lymphomas. So the history can guide you towards the possible reason that is causing the acute or the chronic abdominal mass. If you're not sure, you can start with an X-ray, though which is neither specific nor sensitive, but nevertheless in some cases, like in constipation, you can see fecal loading of the intestines. The best starting point is an ultrasound of the abdomen, which is quite good in picking up growths arising from the adrenal glands, arising from the kidneys, or the growths within the liver and the spleen. But nevertheless, it has got its own limitation. It's very much operator dependent, and usually if the child is quite obese, then it might not pick up some of these conditions. In that case, a CT would be a good alternative, which is quite sensitive in picking up most of these conditions. Again, the treatment depends on the underlying condition, and if you treat the underlying condition, obviously the abdominal mass would be cured, and that's pretty much about it. If you have liked my videos, as I told you earlier, please share it with your friends, and if you've got any questions regarding the abdominal masses, put it down in the comment section below, and I will get back to you in a couple of hours after posting of your questions. So have a good day and bye bye.